Well, in the past, the health IT person was usually focused on the IT portion of their job, and now IT is probably the minimal portion of what they have to do. They have to be good ambassadors. They have to learn how to listen really carefully to the needs of their clientele or their constituencies, figure out how to make peace between factions who may have complementary and sometimes conflicting interests, and then figure out a way to use the information portion of health IT, to actually determine value and then how to share that value and turn that value into action. Being a change agent means that you really have to understand the change process, and change works along a continuum, and there are people who are in pre-contemplation and not even thinking about change, and when you are trying to introduce it, you need to understand where they are on that journey, and you need to move them from pre-contemplation to contemplation to action, and it takes a certain amount of skill and cunning, actually, to determine where somebody is, how to appeal to incentives that will encourage them to take actions that are in their best interest. But one of the things that's difficult about healthcare in particular is that healthcare professionals identify themselves by the role they play. And so when you're coming in as a health IT professional to talk to somebody who's been in a clinical role, you are challenging not just what they do, but you're challenging who they are. So it takes a special kind of personal touch to figure out how to make sure that you're going to listen to what it's going to do to make them a better clinical professional, not to install the health information system that you think is good for them. If there isn't collaboration that occurs in the community, and if people aren't looking at the general interest of the community as a whole, the government will step in. And thank goodness that the government did step in to create the Meaningful Use program, because electronic health records had existed for decades, but the fact that they were not prevalent and widely used was an indication that vendors and the community really weren't working together. So now that we've reached a certain critical mass with the deployment of electronic health records, the question is, how do we get to the next level within the health IT arena that is much broader than electronic health records, that will help people in ways that we can't even imagine just now, but that we've got a hint by looking at what apps do. The difference between what we are doing with apps and what we need to do in the future is the lack of coordination and collaboration and communication that occurs between apps and the electronic health record. So I see the job of the health IT professional to span the entire spectrum of health IT and figure out how you can really make a truly big difference between providers and then patients and their families. And you have to involve all of those parties in order to be effective.